It's been more than a year since the COVID-19 pandemic changed the world as we know it. But despite the potentially life-threatening nature of the virus, many individuals and businesses still do not adhere to the COVID-19 prevention measures. A team of researchers at the University of Pretoria's Economics Department, funded by the African Academy of Sciences and its partners, seeks to understand what drives individual compliance with COVID-19 preventive measures. This is done by looking at how people's behavioral preferences influence their compliance. Risk tolerance, patience, cooperativeness, and altruism. In other words, willingness to give up some of one's own benefit to help others, were included in the investigation. Through this study, the team has discovered valuable information about individual compliance with COVID-19 prevention methods among the study participants, such as people who are less impatient and more altruistic are more likely to comply with lockdown regulations, and to show behaviors like social distancing and hand washing, all of which are aimed at reducing the spread of COVID-19. People who are more cooperative are also more likely to comply with COVID-19 regulations. Men demonstrated less compliance than women, and respondents from low-income groups showed more compliance than their higher-income counterparts. Interestingly, among low-income group respondents, the more risk-tolerant people are less likely to comply with behaviors to reduce the COVID-19 spread. In contrast, among higher-income group respondents, risk-tolerant people are more likely to comply. The researchers also found that people were more compliant with lockdown regulations under higher lockdown levels, which suggested their behavior is influenced by their perceived level of risk of infection. These findings suggest that COVID-19 related restrictions should be combined with policy messages that encourage unity, cooperativeness, and patience in our society. Together, and with a better understanding of ourselves, we can create a better, more caring, and prevention-compliant South Africa.